Good night. We're here with Dr. Ana Lorena Godinez, and we're going to ask her some questions about drug addiction.
Which has been your most impacting cases in this drug abuse sector?
Okay, I've been a physician for 35 years, and I remember, Luis, one night I was called because a patient was unconscious, lying on the floor because he had drunk. And I had to decide if he needed to go to the hospital or could be managed at home. I was very young. Fortunately, I took him to the hospital and had the treatment going. Otherwise, I think he would be dead. And Luis, I've seen cases where you losing job, family problems, problems with justice, going to jail by driving drunk. And it's all so real, honey, that you're very young and you don't know the consequences. And the other thing I would like, it's very important for me, for you to know, is once you begin drinking and you're hooked on it, it's very hard to stop. And even though you go to therapy, and even though there are marvelous programs with Alcohólicos Anonymous, you deny that you're not sick. So I'm working on a case where the patient says, I'm not sick. So we're seeing all the problems that I told you.
And are there any new technologies that could help in the treatment?
Yes, when I was very, very young, the only drug that was available was called Antabuse, and you felt terrible. It was like taking the drug and you began having like the effects of a hangover. So sometimes wives used to put it on the patient's food, so they could avoid the alcohol. Fortunately, there are two pharmacological treatments that cut down the desire to drink, but don't have those unpleasant side effects. I think those are some advances, but I insist it's a multi approach. You have to support the patient, you have to have psychological, medical, and it's a day-by-day treatment.
Thank you very much for your time. We hope to see you again.